today's topic is going to be on getting valuable work experience, and how you go about doing that. Obviously, with medical work experience, it is really difficult to try and find some, especially when you're thinking about hospital placements or GP. I think it's a little bit harder to get, and you do have to be quite persevering towards getting that work experience. So if you guys are in year 12, obviously make sure to already have done some work experience, or in the summer try and organize something. Don't wait until year 13, because by that time you would have probably already submitted your personal statement, because obviously with medicine you have an earlier deadline. So if you haven't done anything yet, try and prepare for it to be done over this summer, so that you can at least be able to write about it in your personal statement and talk about it in your interviews if you do end up having a November interview. Just a little bit about SixMed. So it's created by medical students for other medical students, and we hold lots of different events. So the one you're attending now is one of them. But we also have UCAT and BMAT support, so that can be either one-on-one, or we do like large group courses as well to talk you through each of the sections. And then later on in the year, we do some interview prep as well. So a bit about me. So this, I think, hasn't been changed since the presentation was made. So just in terms of the updated thing, so I'm a final year medical student now. I did intercalate 2 years ago, and I normally study at Bristol, but I intercalated at Imperial. I do really enjoy teaching, and I'm quite interested in like surgery and medicine as well. I'm not really sure which specialty I want to go into, but I'm just going to explore that once I start my job in the summer. So just generally what we're going to cover today. So we're going to talk about sort of what work experiences you can actually do, or what work experiences count, and then talk a little bit about the role of a doctor, because that's quite essential when you're doing your work experience, to think about what kind of skills or what kind of roles they have in the workplace, and how you've developed those skills yourself, and how you're going to implement that when you start medical school. And then we'll talk about the different types of work experience you can do, and whether one is particularly better than another. And then I'll talk through sort of the kind of work experience I did before I started university, and then we'll talk about how you reflect on your work experiences and how you can talk about it in your personal statement. Because just doing the work experience isn't really going to get you very far. It's actually what you learned from it and how you're reflecting on those experiences, which is going to help you get the personal statement, get the interview offer, and the interview invites and things like that. And then just some general advice, and we'll do a bit of a Q&A. So as usual, I try and keep the session quite interactive. I think there's some questions on there. They might be a little bit outdated, but I'll just modify some of those questions, and feel free to type your answers in the chat. Just make sure that you're muted during the session, just to avoid any disruptions while I'm going through the PowerPoint. We'll skip this one. Just moving on to aims. So the main thing I want you guys to get out of today is to understand why work experience is so important for getting into medical school. Obviously, it's one of the desirable criteria, because it can help you really talk about it in your interview, and reflect on what the NHS is like, or what the job is like. It also helps you get an idea of the different types of work experiences you can do as part of your journey into medicine. That's what I want to get across today. So just if you can type your answers into the chat for this one. So what do you think is work experience, and give some examples of some work experience maybe that you've already done, or that you're planning on doing, or that you're thinking about organizing. I'll give everyone a couple of seconds. Okay, that's fine. If no one wants to type it in the chat, that's not a problem. This was just more to sort of like get you guys engaging. So if you don't want to, that's fine. But if you're happy to give some suggestions, feel free to do that. There's lots of different types of work experience that you can do. So just a little bit about work experience in general. It's obviously pretty self-explanatory. You spend a period of time in a particular area of work to learn about the role. And in medical work experience, it tries and to help you understand the different roles that a doctor takes on. Um, Generally, it doesn't have to be medical work experience if you're really struggling to get that work experience, but just think about sort of any people-focused work experience. So that could be working in a care home or just, working as in customer service, all of that because you're using those communication skills and those teamwork skills, which are transferable into medicine. They'll all be useful to talk about. And as I said, they can be voluntary or paid. So if you have like a part-time customer service job, like a retail job, or if you're doing part-time tutoring and you're interacting with children, and that shows that you're able to adapt your communication skills and also show your teaching skills, all of which are useful to have in medicine, that will still be useful. So the two ways in which I split work experience is looking at sort of working with people in a care or service role. So if they're disabled, if they're ill, or if they're elderly. So for example, care homes or residential volunteering homes, that kind of thing. Or working with homeless people, so homeless shelters, all of that will be useful, or just directly observing healthcare is the other one, where you're doing more of the observation rather than actually sort of directly interacting with patients. So work experience, there's a lot of reasons why medical schools try and get you to do it before you apply to medicine. Obviously, it's a career where you're going to engage in some lifelong learning and you're caring for people who are quite sick and quite vulnerable. So they do depend a lot on you. So work experience can really help give you an insight into what the doctor actually does. And in another way, it also shows your commitment to medicine because you're showing to the interview panel that you've really explored this avenue and you're definitely sure that this is the pathway for you. And because you are committing to quite an academic career, one which maybe requires you to do more than some other careers, especially with your postgraduate exams and your specialty training and attending courses, doing research, all of that, which may not necessarily be things that you have to do in non-medical careers. Or non-healthcare careers, by starting with work experience, it really shows you whether this is the right fit for you, and it also shows to other people that you're committed to this career. It also helps you identify the qualities of a good doctor, but not just that, it helps you demonstrate that you yourself have those skills already and you've developed them through your work experience, through your volunteering or through your hobbies that you've had long term. And it shows that you understand the realities and difficulties of being a doctor as well. So obviously you guys must have heard about things like striking and reasons for striking and pay gap and the junior doctor contract, but actually seeing it in action in the hospital and seeing, you might have read about things like the A&E crisis, but actually doing work experience in A&E or in GP and seeing the large volume of patients that doctors have to deal with in a limited amount of time with limited amount of staff and resources, it can really put into perspective how big that problem is. So it can definitely give you an insight into the difficult side of being a doctor and give a bit of a reality check. And by acknowledging the realities of a doctor, it also shows that despite there being some negative aspects of the NHS, you still want to pursue medicine and you're able to give your reasons as to why. So I think this is a good question. It would be really good if we get some engagement on this one. What do you guys think are the traits of a good doctor? Just type them in. So I'll throw one out there just to help people along, like teamwork is a good one. Any other skills? What have people said? Perfect. So someone said leadership, great. Anything else? Communication, good. Any other ones? Empathy is a really good one. So I think communication, empathy often go hand in hand. Teamwork and leadership often go hand in hand. Any other ones? There's loads. Yeah, so confidence is a difficult one. It's good to be confident in what you're doing to instill confidence in other people, but it's about balancing that and not being too confident or not being confident enough. I think it's important to strike a balance. Talking skills, I would say that's probably the same as communication, but yeah. Um, Other things are sort of professionalism and competence. So someone said competence, and also advocating for your patients. So being a patient advocate, and those kind of things. So let's have a look at the other ones here. Being approachable is one of them. Making sure to listen and communicate. Honestly, I think we've had that one already. Being non-judgmental, um, being passionate about learning. So thinking about you as a doctor yourself, you need to have that drive to learn because medicine's constantly changing career, and you need to keep up with that. And the only way you can do that is by having that drive to learn, because if you don't have that, then it'll be very difficult for you in the specialty where you're thinking, well, lots of things have changed, but you might still be using old methods. So you need to have that drive to change, but also that passion to learn about new change. Being a good leader, we've had that one already, and empathetic. Obviously, these are only 6 things, but there are way more qualities that lots of different doctors have, which are really good. A guidance to read if you want to sort of get a better understanding of the expectations that you need to have as a doctor is the GMC guidance to good medical practice. And if you it's a very short document, it's written in all bullet points. I mean, it's probably good to read it early on because you'll use that guidance when you're doing your SJT section of your UCAT, and you'll probably use that section when you're answering some types of questions, like the ethics questions in your interviews. So it's a very, very useful document. I mean, I'm a couple of months before starting work as a doctor, so I have to read it before starting as well. So it's just a good guidance to know sort of what to do, what not to do, and just make sure you sort of look over that every so often. Okay, so some of you may have completed work experience, some of you may not have completed work experience. For individuals who have, would you be able to share, if you're okay with doing so, what work experiences you've already done? Okay, so one person, so Kieran's done work in a charity shop, perfect. Any other ones? That's really good because then you can use your teamwork communication skills. You've done hospital meet and greet, which is great. Working in a primary school, great. So all of these are really, really good as well because it just gives you that interaction with people. May not necessarily be patients, but you are interacting with people, so you're developing those skills. Working in a care home, great. So we've got a mix of different things. So there's 2 different types of work experience. So there's the medical ones and then the non-medical ones. Medical ones, direct observation of healthcare. I would think about things like GP and going to a hospital setting and working in a specific ward. But other types of medical work experience to think about is, as some people said, care homes, working in residential care homes, which is what I did. So I worked for a company called Revitalize, where you basically stay in the care home for a week. All the volunteers get a separate accommodation, and essentially you're looking after the elderly or patients with disabilities or learning difficulties who are also staying there as like a sort of holiday week, so that the people who normally care for them are able to go away and have some time off. So that they usually come to this residential care home centre, and the volunteers essentially look after them. So I helped with things like feeding or just speaking to them, making cups of teas and coffees. Most of it was just giving them some company and learning more about the conditions and how those medical conditions sort of affect their daily life, and how it's affected things that they normally would be able to do but now can't do. So it was very interesting. So if people are interested in doing that, definitely it's free to do, but you do have to sign up quite far in advance. And there's a couple of centres. There's one in Southampton, which is the one I went to, but there's one up in Scotland, and then there's another one which I can't remember. I think it's somewhere near Essex, maybe closer to London. So yeah, if that's something of interest to you, definitely have a look at that, because I was able to talk a lot about it, and it wasn't necessarily direct medical experience, but it did help me develop my communication skills, teamwork, and still get to know how a certain condition can affect the person's sort of entire life. Hospices is a bit difficult to get. So hospices is where people go for end of life care. I think as a year 12, year 13 student, it's a lot harder to get in compared to like a medical student, for example. So you can try it out if there's a local hospice near you, but if it doesn't work out, it's not the end of the world because they are quite difficult to get in the first place. Working in nursery, so someone said working in primary school, so that's really good. Again, dealing with people who are vulnerable, so young, very young children, and also learning how to adapt your communication style according to the person in front of you. So they're not obviously going to understand like some types of words. So being able to adapt your communication style, break down information into smaller chunks is really important. Working in special needs school, again, using different methods of communication in order to help these individuals. You could do first aid volunteering. So this was another thing I did. So I did the St. John's Ambulance volunteering program, and essentially you learn things like first aid, you learn basic sign language, and things like that to help improve your communication skills. And then you focus on sort of CPR and you learn the algorithm for that and things like that, which can again be really useful skills to have. And it also shows your commitment towards healthcare. And then the other thing you can do is if you're particularly interested in things like mental health, you can be a volunteer where you answer the mental health phone line. So you speak to patients or individuals who are, they probably won't give you people who are in crises, but they might give you people who often call up just to speak about their mental health conditions and maybe have a go at speaking to them or listening in on the calls that other professionals may be having with them to see how they deal with individuals with mental health issues. Okay. Other types of work experience, so this is the non-medical side of things. They're still useful, especially if you can't get a lot of the medical ones. Paid employment, so working in any customer service role counts, or if you're working in catering or things like that, so having to be organized, teamwork, communication, again, all of those skills come into it. Other aspects, so if you just do general volunteering, so I know a few people said they've done volunteering in a charity shop. That's something I did as well. But again, it's sort of like a customer service role because you're speaking to a lot of individuals. Other things, if you're particularly religious, volunteering at your local church, temple, or mosque can also be quite good. Or doing things like scouts or guides can also be good. So there are some virtual work experiences if you're really struggling, and the reason they came about in the first place was because of COVID, and because people just genuinely weren't able to go into hospitals because of the risk of COVID and other diseases. They did develop some virtual work experiences. So the most popular one, which I think most people will already know about, is the Brighton and Sussex Medical School free virtual work experience, where they essentially take you through like a week course, online course, and they make you watch a lot of different videos and about different patients and their experiences. It's quite interesting. I mean, even if you do have quite a lot of work experience in person already, it's still something that's probably quite good to have a look at, because it will be a lot more, you can go at it at your own pace really, and you can watch the videos in your own time and really focus on taking some notes and reflecting on what you've learned. I wouldn't say only do this work experience, try and get some in-person ones as well, because lots of people would have done this Brighton and Sussex Medical School work experience, which will then mean that it will be very difficult for interviewers to differentiate you from someone else if you're both giving the exact same examples. So that's one downside to virtual work experience, because everyone will have the same patients. So always try your best to get in-person stuff so that you stand out and you're unique when you're giving your interview answers or your personal statements. And the other one is Observe GP. So it's an online app where it just helps you explore the role of primary care. There's again some patient videos about their health conditions, particularly chronic health conditions, and then just generally some videos to understand sort of how primary care works. The other one is the Wander VR patient journey to GP practice app. So it takes you through some virtual reality scenarios and things like that, and talks you through how you would deal with different patients. And again, can give you an insight into primary care. This is just something I found a couple of years ago. I'm not sure they might still be doing this. So if you type in York and Scarborough teaching hospitals, they quite openly advertise their clinical work experience. They're very keen to have year 12 and year 13 students to try and show them what medicine is like. So if either you're located quite close to York and Scarborough teaching hospitals, any one of them, or if you're happy to sort of travel there and do some work experience if you're really struggling elsewhere, just have a look at the shadowing opportunities that they offer and go from there. Okay. So volunteering work is really good to have as well. And I can see from the chat, lots of people have done lots of volunteering already. It can help you develop lots of transferable skills, as I mentioned before, particularly things like communication and teamwork. So if you haven't done some some volunteering already, and you'd be quite interested in it, think about things like Do It or Nextdoor, which are websites where you can go and look at different volunteering opportunities near your area. The other thing is near your area, wherever you are, that at least within driving distance, there should be sort of a homeless shelter or something like that. If that's something that you're happy to do and go and explore and see what kind of services we offer for them, that's something really good to speak about in your personal statement as well. But obviously don't feel pressured to do it, only if you really are keen on doing it, then you can go and do that. Okay, looking at whether some work experiences are better than others. Personally, I don't think so. I think that all work experience is good experience because one person could have got the best hospital work experience, but they're really bad at reflecting on it, so it doesn't come across well in the personal statement. So they're less likely to get an invite from an interview. On the other hand, there might be a person who's done non-medical work experience, but really reflected well on it and showed what they've learned from it and how they can transfer their skills into medicine. They're probably more likely to get an interview invite. So it's all about what you do with the work experience, not what the actual work experience is. Obviously, having the medical work experience gives you the edge of sort of the insight into the roles of a doctor. But other than that, you can sort of transfer all of that information across. So yeah, so just the main thing to remember is just reflection is the important thing. Okay. So if you can't get any work experience, you can do quite a lot of alternatives. The first thing, obviously, don't panic. Try that online work experience measures that I've sort of pasted across in the other slides. So BSMS or the Observe GP ones. The other thing you can do, if you're particularly interested in a certain specialty, consultants may not necessarily always check their emails, but if you are able to get someone's email or get into contact with someone whose field you're particularly interested in, you can arrange some video calls with healthcare professionals and ask them questions about their job. What's the good? What's the bad? What's the realistic, outlook on this career? In 10 years' time, like where did they get to in their career? And because all of those questions will be very similar to the ones they ask you in your interviews. So really try and pick their brain and try and find out the good, the bad, and the ugly, essentially, about the career. And then if you're still not able to do that, obviously do the non-medical work experience. That's still really good. And if you want to gain more insight into the roles of the doctor itself, but you're not able to get sort of secondary care experience or GP work experience, just read about the profession to gain insight. So there's lots of medical books that you can read. So the most popular one I think people might have come across is things like This Is Going to Hurt. There's also another one which is about the man who mistook his wife for a hat, and it's all about these psychiatric cases and functional disorders where people are completely fine, but they can't use their arm because they've actually got lots of trauma going on, which then presents itself as physical symptoms for some patients. So if that's of interest to you, read that book. And the other one is When Breath Becomes Air, so that's another good book as well. The other thing to think about is online articles or interesting medical cases. Now, good places to go, that probably the most reliable place and the one that's easiest to read, in terms of not having too much medical jargon and easy for you guys to read, understand, and talk about in interviews, is BMJ, Best Medical Practice. It's a little magazine by the British Medical Journal, and they have some interesting cases on there that you can have a look at, or some interesting debates on things like the junior doctor strikes and current hot topics. And that will be really useful for you because it probably will come up in interviews, so it's good to keep up to date with the current topics. The other place to go to is the Medic Portal. They have lots of short summaries on different current NHS topics. They have lots of practice interviews, questions you can answer. I think they have a massive question bank. It was the one I used, and it's still the one that's commonly used by other students. And the other one, we've got some 6med resources as well. So if you have a look on the website, there's some articles on current NHS hot topics as well. So there's lots of free resources available, is what I'm trying to say. Just talking about my work experience journey, bearing in mind this was all done between sort of 2016 to 2018. So I'm a lot older, so I'm 24 now, so it's obviously 7, 8 years ago now. These are different things I sort of did. So the first thing I ended up the first bit of exposure into medicine for me was doing some local GP experience. It was sort of one of the GPs in my area, and I spent a week there during my October half term in year 12, I think, or no, in year 11. And I essentially just spent some time sort of mostly doing admin and helping people at reception, but also spending some time sitting with the GP in their clinics and sort of learning about how they speak to patients, and also sitting in with the nurses in their vaccination clinics. It was all really interesting. So that's kind of what I did. And then I spent a week in hospital. So I ended up being in the maternity ward in obstetrics and gynae. So I saw a little bit of, and I saw a bit of pediatrics and newborn babies as well. So I saw a variety of different patients, and then I saw some genetic reproductive clinics as well. So it's genetic disorders which patients can present with, which can then affect sort of their reproductive system and things like that. So that was quite interesting. So that's what I did for the second week. So that week was sort of an arranged week by our school, and we had to find our in-hospital work experience, and it was the luck of the draw. That's the specialty that I ended up going into for that week. I then organised sort of the Revitalise one that I mentioned to you guys, the residential care home volunteering, and I did this actually after I submitted my UCAS application, because that's just when the dates fit with the options they were giving at Revitalise. I ended up doing it during October half term, which was after the submission deadline for the personal statement. Yes, I wasn't able to talk about it in my personal statement, but I was able to talk about my experiences in my interview, and it was still fine. So yeah, if you are going to do things after the submission deadline for UCAS, just make sure that you still have other stuff to talk about. So make sure you've done some stuff at least before, so you can actually write a good personal statement. But I'm guessing, so, I think in the next couple of years they might even scrap the personal statement. So it really, yeah, and they might just ask you some general questions about your experiences. So yeah, I guess it will depend on your guys' year and what happens in terms of UCAS and everything. And then this was a bit more long-term things. So I did St John's Ambulance first aid volunteering. So that was throughout my A levels, and then the age concern volunteer for a year. So that I did it as part of my DVA volunteering section, but it was quite useful to talk about in interviews as well. And then I did read some online articles on interesting medical cases. So the main medical cases I read about was things like Andrew Wakefield and the scandal between how he claimed that having their MMR vaccine can cause autism in children. The other one I looked at was Harold Shipman. And that's a very interesting medical case, thinking about sort of professionalism in medicine. Yeah. So remember when I talked about sort of reflection about your actual work experience? So I would generally, before you arrange your work experience, follow this sort of structure. So before your work experience, try and research what different types of work experience opportunities you have. You can tick that off because you've kind of attended this session today, so you have a general idea of what you can do. But just go and look more closely in your area, like what things you can do. The second thing is contact individuals really early on. They do take really long to reply. So give yourself as much time as you can. So all of you have attended this session today. So maybe tomorrow or in the next week, have a look at the opportunities near you, arrange something, email them, let them know your interest, let them know that you're pursuing a medical career, you would like to do some work experience, and maybe even give like 1 or 2 specialty suggestions that you would like to explore a little bit in that week. Give them exact dates. If they don't respond to you within a couple of weeks, try and see if there's a number for their ward, just call them and ask them, or a number for HR there, and just call them and ask them, like, what can I do? How do I arrange work experience, kind of thing. Be really organized, that's the main thing, and that's how you're going to get most out of your work experiences. Whilst you are doing your work experiences, though, make sure that you're observing what skills those doctors are showing in different clinical situations, and try and match it to how you've developed those skills yourself, and try and with every patient you see or with every clinical encounter you have, just take a notebook with you and write down what you've seen. Obviously, don't include patient information. You can just say this was a 39-year-old lady who came in. That's sufficient information. Just write down what they came in with, how did the doctor deal with it, what did you find particularly interesting about that clinical encounter, what skills did you notice that that doctor had displayed really well, and how did those skills actually help the patient maybe trust them or share more information and things like that. So really reflect then, because by doing all the work then and all the thinking then, you make your life very easy when you come to writing the personal statement, because it will just be, you know, you'll be able to do it very quickly if you do most of the work whilst you're actually doing your work experience. The other reason why I say to reflect as you're doing it is because a couple of months later down the line, when you're actually writing your personal statement, you are not going to remember the details of what you've actually seen. So I've worked at a lot of courses or like summer schools where I've helped people with their personal statements, and loads of people can remember vaguely the example, but they can't remember the outcome or the skills that the doctor used. So it's a bit of useless work experience really if you can't remember what you've seen. So write it down as soon as you do it, and ask lots of questions. So these questions don't just have to be, oh, why did you do that for the patient? What is this medical condition? Can you explain it a bit more to me? Ask them about their career, like really try and find out whether this is the right career for you. And try and explore that, because that's what you're there for. So ask them, what is the good and the bad about this specialty? Why did you choose this specialty over something else? What do you think are probably the most common struggles that's going to be coming up in the future for doctors? How do you think we'll have to deal with that? Ask some, insightful questions. Ask about how the NHS is run. Just be curious about everything. Because those are the kind of questions that interviewers will test you on. They might ask you, where do you see yourself in 10 years' time? And you need to be able to show like that you understand how the training pathway works. So ask the doctors about it, because they're the best people to tell you, because they've been through it. And similarly, the interviews will probably test your knowledge on things like A&E crisis, the GP crisis, the long waiting lists, how Brexit has impacted on the NHS. So ask those questions to the doctors so that you can give, quite a good answer when you actually do your interview. Afterwards, as I said, do a reflection diary. So this is exactly what I did. It was actually something our school encouraged us to do, and they marked us on it because they just wanted to help us with reflecting so that we won't have to do loads of work afterwards. And it was such a good thing that they made us do. So if your school doesn't do it, at least you know that you've attended today, so you will do it yourself. And then you can use everything in your personal statement. Similarly, that reflection diary is also going to come in handy for your interviews, because with interview questions, you need to use examples from your work experience to show what you've learned. So it will be such a useful book later on when you come to sort of preparing for interviews and personal statements. So yeah, I just essentially call it reflection diary. With each day, what I used to do is just pick sort of 2 or 3 patients who I thought were really interesting and write 2 to 3 sentences of what happened within that event with that particular patient. And then I would list at least 3 qualities that the doctor in that situation demonstrated really well and reflected on why those qualities are essential for a doctor. So for example, it could be they communicated really effectively to a patient who came in with difficulty hearing and forgot to bring their hearing aid, and they used lots of hand gestures and slowed down their speech and tried to speak a bit louder or tried to sit closer to the patient. So that's all forms of nonverbal communication that they did really well, and they were much more patient with them. They ended up having a longer appointment, but it was useful because that patient was really able to understand what was going on, and they maintained their autonomy so that they were able to make a good balanced decision. Then also think about whether you've demonstrated these qualities in the past, which probably all of you have with communication. So think about a group setting where maybe you had to adapt your communication style. So for the individual who said in the chat who's worked in a nursery, think about maybe a situation where you've really adapted your communication skills, maybe to explain something to a really small child, and show me how that was effective. So that's kind of what we as interviewers are looking for. And then the last thing to think about is try and link back the experience you've observed to why you would be a good doctor or why it's important in medicine. So the structure I use in general for your personal statement paragraphs and for these reflection diaries and for your interview, when you're answering interview questions, is PEEL. So make the point, give the evidence, which will be your work experience example, explain it. So in your explanation, that also includes your reflection. So list the 3 qualities that were relevant to that evidence, and explain why they're important. And then L, link back to medicine. Don't forget L, because that's the one that loads of people do forget, and then they don't score full marks. So general advice, keep the reflection diary. So that's the one thing I'm going to bang on about throughout this entire session. And as I said, work experience doesn't have to be healthcare related. It's obviously an added plus for you, but if you're really struggling, just do general work experience and then back it up by reading some medical related books, so you still have that insight into what a medical career is like. And as I said, ask lots of questions. So these are some links in terms of sort of guides to work experience. What can you do? The second link here is a really useful link. So it's the Medical Schools Council link, and essentially it also has, it's essentially a booklet with all the universities in there that offer medicine, and it's got really important information about the sort of grade boundaries they need for you to, sorry, the predicted grades even that they need for you guys to get into their university, how they're going to assess you, whether it's going to be an MMI or a panel interview. They do update it every year, so they may not have updated it for your guys' year entry yet, but just have a look at the current year's entry requirements and just have a look at what kind of things they expect or what kind of things they've done in the past. They might change it for your year, but it's just a good starting point to think about what kind of things they really like in a candidate so that you can tailor your application to that. So just be really strategic as well. If you want to go to a specific university, like make sure you tailor your application to that university and make sure you've checked all the boxes for them. And then the last one is the GMC guidance. Essentially just some information about work experience, but also in general, if you just type in GMC guidance to good medical practice, that will come up with that guide I told you guys about earlier, which I recommend everyone reads before they apply for medicine. Okay, we'll skip that one. So that's the end of that session. So I'll just open the floor to questions if anyone did have any questions. If you didn't have questions, that's the end of the session, so feel free to go. And yeah, have a good rest of your day. But I'll just hang around for a couple of minutes if anyone did have questions. Please put that in the chat and I'll try and answer them. Okay, can homeschool students apply to medicine? Will I be at a disadvantage if I do? Thanks. I don't think you will. I don't think it makes much of a difference if I'm going to be completely honest, because the main thing they're looking at is your work experience kind of stuff and the rest of your application. I don't think it is going to put you at disadvantage. No problem. Enjoy the rest of your day as well. Any other questions? Okay. We'll end it there then if there's no more questions, but nice to have quite a few people in for the session as well, and hope you enjoy the rest of your day.